Orthofacts Every Medical Student Should Know, Part 5. Today we're going to go over sprains versus strains, as these are common concepts that medical students mix up. The main difference between a sprain and a strain is the type of tissue that gets injured. So for a sprain, that is a ligament, and for a strain, that is a tendon. I typically like to remember as strain has a T and T equals tendon. Let's use an ankle for an example. So on the left side, we can see a strain. This is going to be an injury or overstretching to a tendon going to the ankle. And on the right side, we have a sprain. So we can see these little ligaments going from bone to bone. A sprain would be an injury to one of those ligaments. Now, I mentioned that they have similar mechanisms of overstretching, but there are some key differences. A sprain is typically with an abnormal movement to a joint, stretching a ligament or tearing a ligament, while a strain will be an overstretching or contraction to a tendon. Now, let's go over the grading systems for each. Both sprains and strains are graded from 1 to 3. Here I have a picture of sprains. So grade 1 will just be some small tears and stretching. 2 is worse with some large tears, maybe an incomplete tear, and 3 is a complete rupture. Strains are going to be very similar with the grade 1 through 3 system. So grade 1 will be like a microscopic tear with minimal injury, minimal pain. Grade 2 will be a partial tear with decreased strength and localized swelling. And then grade 3 will be a complete tear with severe pain and complete loss of function. A sprain will typically present with some joint instability on exam, while strains will present with weakness or pain with active contraction, but will have full passive range of motion. Thank you for watching. For more orthofacts, follow.